Hi, I'm Dr. Mark Poray, a sports and family chiropractor in Whitby, Ontario. Today, I want to carry on from my last blog where I spoke about the reluctance of some family doctors to refer their patients to chiropractic physicians, even after the overwhelming evidence in favor of chiropractic treatment of low back pain, as it was presented in the Magna Report of 1993. Well, to be fair, a lot of progress has been made, and the Ontario Chiropractic Association is making great strides in creating opportunities for chiropractors and family doctors to work together for the benefit of Ontario residents who suffer from low back pain. Here are some of the pertinent facts of which you should probably be aware. First, in Ontario, low back pain and other musculoskeletal issues represent about 11% of all patient visits. That's more than 1 out of every 10 people that could be seeing a chiropractor first. Second, 80% of adults suffer from back pain at some point in their life. 80%. Third, low back pain is second only to the common cold as a cause of lost work time. A phenomenal statistic. Fourth, low back pain is second only to cardiovascular disease as a major cause of chronic health and long-term disability. Fifth and last, direct and indirect costs of low back pain care in Ontario are $1.2 billion annually. That's 1.2 thousand million. While most back pain patients do recover, recurrences are fairly common, and those who do not respond to the care the family doctors propose create a problem and become the most common reason for referral to specialists, the most common cause. These patients are generally prescribed non-steroidal anti-inflammatories, narcotic medications, and referrals for surgical procedures. So wait times for spine surgeons in Canada is extremely high, up to 7 months, and many of these are not even surgical candidates. In some cases, primary care physicians recognize certain red flags like progressive neurological deficits or fractures which require immediate referral, but difficulty arises when the doctor is trying to distinguish borderline cases. So really, except in emergency cases, non-surgical, progressive, more than invasive approaches should be exhausted first. So chiropractic care is one of the most conservative, non-invasive approaches available. Reports indicate that only 10% of those referred to specialists following an MRI turned out to be surgical candidates and were referred back to their family doctor. This represents a huge waste of time and resources which could easily have been avoided by a different approach model. With the research already done and understanding how the current model is failing back pain patients and industry in Ontario, chiropractors are making a case that chiropractors should be the gatekeepers of low back pain, and if that happens, then the first thing that will happen is there will be a reduction in the use of medication and unnecessary testing. Second, there will be an increase for family physicians' ability to deal with more pressing cases. And third, it would reduce waiting times for specialist referrals, reduce duplication of diagnostic costs, and of course reduce drug benefit costs. One of the most common barriers to the delivery of care for low back pain identified by family physicians is time. They don't have the time necessary to explain, demonstrate, and supervise exercises and various treatment options. So in conjunction with the Ministry of Health and the Ontario Medical Association, the consulting chiropractor role in primary care was developed, where the doctor of chiropractic performs a 30-minute assessment on patients previously identified by their family doctor. As a result, the patients who participated in this study benefited from this assessment and returned to work much faster. Participating physicians felt this model of care would reduce patient wait times and physician loads. Finally, there are a couple of quotes from a couple of the participating family physicians. The first one was this: "I actually think, and you can put this on record, most chiropractors I know are much better at doing an initial assessment than most of the primary care physicians I know." And the second quote was, again, a lot of times patients are sent to spinal surgeons because the physician wants that MRI or wants to know, should I prescribe an MRI? Whereas oftentimes a chiropractor deals with that imaging on a daily basis. And they're fully equipped to turn around and say, okay, this person does not need an MRI, and this is why. And they don't fit because they don't fit the criteria, or they do fit the criteria. So in general, I'm pretty optimistic that more and more informed young physicians are seeing the big picture and are not afraid of sharing the care of their patients, especially when they know that chiropractic care for back pain is so beneficial to their patient, their own practice, and the healthcare system in general. I'm Dr. Mark Poray. Please glance through my other blogs regarding specific musculoskeletal conditions that I and many chiropractors treat. You'll find them on my website at www.drporay.com. drporay.com. Thanks.